We have so many animals now that we've come up with a system to tell you all about them.
And I actually agreed with Lucille. Mark your calendar. First, we have 3 cats. Go!
Miss Pitty-Pat's eyes and skin have a yellowish hue. Red seems very thin and irritable. Nitty is having a lot of trouble breathing. We also have 2 dogs. Go!
Happy is up and gone lame in his rear leg. Horace, well, I found something you're going to want to look at. And finally, we have 1 chinchilla, Chubbs. Go!
We've seen some problems with his coat, especially around the eyes. That should be all you need to get started, Doctor.
Yup. Now it's your turn to go. So far, so good. That reading's pretty clear, wouldn't you say, Doc? You're just brilliant. Does everything seem normal? That's not a good sign. This will help you breathe easier. What does that tell you? That's some good news. Which meds do I give out again? That'll help it heal. What do you think it is, Doc? Houston, I think we have a problem. He doesn't look too good. Okay, now I'm confused. You know just what to do. Amazing. I'll administer the meds if you tell me which ones to administer. Deal? I'm on it, Doc. That'll stop infection. That eye discharge with the swollen eyelids has been bothering her for a few days now. She came in with the red scabby patches around her eyes, nose, and feet. You may not be able to see them all, but patches of hair are missing all over her body. When they raided the owner's apartment, they found chinchilla pellets and rabbit pellets. She had bedding made of cedar shavings and used a large wire cage with a plastic bottom. I'm betting the cage wasn't cleaned all that often.
Chubbs was suffering from ringworm, pneumonia, and an eye infection. Ringworm, a fungal infection, causes crusts, scabs, and hair loss in animals, and unfortunately, it's very contagious, even to humans. On top of that, the cedar shavings in his old cage created the irritation and infection around his eye. And the dirty cage made it even worse. If that weren't enough, Chubbs caught pneumonia when the environment became too hot and humid for him. The pneumonia could have been fatal without prompt treatment. The antifungal and antibiotic medication should clear up most of his problems, and Kevin needs to make sure his cage and bedding stay clean to prevent reinfection. Your diagnosis is spot on. You asked all the right questions. Good job! I'm very impressed by your treatment. I couldn't have done better myself.
This dog's been hit by a car. Doctor, you'll need to see him right now. It's so sad. Just look at him. That probably feels worse than it looks. What does it all mean? That's much better now, isn't it? I'll mark down these vitals. Not good. What's the meaning of this reading, Doctor? I'm impressed. You have a superior understanding of this case. Fluids administered. What does this reading tell you, Doctor? You've got a thorough understanding of this case. That makes sense given the symptoms. That doesn't look good. We have to rule out all potential issues. All clear. The patient has been prepped for surgery. I bet you're glad that's done. Almost done. This animal is obviously in good hands with you. Your treatment was textbook, Doctor. Yes, the dog was hit by a car about a mile away from here. A concerned citizen picked him up and brought him in here, hoping to save him. Yes, he was conscious, but he looked like he was in a lot of pain and had difficulty breathing. I haven't noticed any serious bleeding yet. He does look like he's in a lot of pain.
Dogs like Bruno can often be hit by cars because of their seemingly random movements or because the drivers don't notice them. It's fortunate that Bruno was brought to us right away because car accidents can cause internal injuries that are not always visible. The Good Samaritan also knew enough to wrap Bruno in a blanket to keep him warm. Your quick treatment stabilized Bruno and kept him from serious complications. However, he'll still have to take oral pain medication for his broken ribs, and we'll have to keep him in a quiet place for further observation. Your diagnosis matches mine. You didn't ask one wrong question. I'm not surprised. You did an excellent job looking after that animal.
Definitely not a positive sign. Not good. I have a strong pulse reading here. You're absolutely right. Is that high or low? I'm sure Dr. Wang would have said the same thing. Nothing we can't handle together, right, Doctor? That's close to normal, at least. That's good news. The results could be worse. Now we have one less thing to worry about. What does it all mean? All clear. The patient has been prepped for surgery. Could that be the cause of the problem? Fluids administered. I can already see her perk up. She seemed really hungry when she got here, and that's normal for rescued cats, but with her, it seemed like she was starved. Nope, she's quite friendly and lets everyone pet her. She does not appear to be in any pain. Yes, I've noticed nothing abnormal about it.
Obesity causes health problems for cats as much as it does people. In this case, Miss Pittypat was already obese when she became separated from her owners. When she began to starve, her liver couldn't handle all her fat, which caused the fatty liver and jaundice. If you hadn't gotten to her, she could have suffered liver failure. Fortunately, the vitamins and fluids will ensure she lives a long life. Your diagnosis makes sense to me. Quite insightful. You had all the right questions. Your treatment of this case was wonderful, and I'm sure your patient appreciates it.
Oh, look how cute. It looks like someone has been getting enough to eat. Does everything seem normal? Is that good news, Doc? It never hurts to be thorough. Sorry, I know it's uncomfortable, but it will help. I promise. I guess these results could be worse. It's mind-boggling watching you work. You're such a pro. I sure want our animals to feel better, so which meds should I give? Sleepy time. Nice treatment, Doc. I'll administer the meds if you tell me which ones to administer. Deal? So far, so good. Not the most fashionable, but the most functional. All clean and ready to go. Great going! I wish I knew how to do that. That's some expert sewing, Doc. You put other vets to shame, Doc. It's not too tight. It's just right. I'm on it, Doc. This'll get you back on track. Oddly enough, right after we first brought him in. When we walked him outside, he got excited about the other dogs and began prancing and barking. I think he hurt his leg then. Yes, he favors his leg and will not offer it easily. No, just the jumping. He was jumping a lot, now he won't.
Happy tore a ligament when he was jumping up and down, which can happen with overweight and hyperactive dogs. Your surgery repaired the ligament for now, but he could re-injure his knee and become permanently lame if he becomes active too soon. He'll also be putting more weight on his good knee, so he could tear his other knee ligament. The injury could cause arthritis when he's older, but medications can help with any pain. In the meantime, Happy should heal very well since you gave him proper care. I agree with your diagnosis. You clearly understood this case. Quite insightful. You had all the right questions. I'm very impressed by your treatment. I couldn't have done better myself.
See? He looks healthy. I hear the tick-tock of a beating heart. You've got all the answers. It never hurts to be thorough. See, Doc? That's the lump I told you about. See? Just like I told you. Ah, another piece to the puzzle. Doc, you're just brilliant. That's some good news. Very necessary. Which meds do I give out again? Sleepy time. You put other vets to shame, Doc. Not the most fashionable, but the most functional. Nice treatment, Doc. Way to treat a patient, Doc. This'll help fight infection. Now we don't have to worry about infection. All clean and ready to go. You have such a steady hand, Doc. What does that tell you? That's some expert sewing, Doc. So far, so good. Mask number 2 on the way out. You know just what to do. Amazing. It's mind-boggling watching you work. You're such a pro. You're doing an amassing job. No? Okay, I'll be quiet. Whew. I'm glad that part is over. Sure, I'll administer the meds. Which one should I give? I'm on it, Doc. no, fortunately. I haven't noticed anything that suggests he's in pain. It could be nothing, but while doing the initial grooming, I noticed some lumps on his body. No, he's acting completely normal. The masses bother me, not him. All kidding aside, I'm just worried.
While harmless skin masses commonly occur in dogs, Horace also had a malignant tumor. Taking a sample of each mass revealed one contained cancerous cells. They could have spread to other parts of his body, causing pain and even death. Horace could have needed chemotherapy and radiation therapy, but the surgery you performed took care of the immediate threat. With the pain medications, Horace should be feeling better soon. Your diagnosis makes sense to me. Quite insightful. You had all the right questions. I'm very impressed by your treatment. I couldn't have done better myself.
She doesn't look too good. Not good. What's the meaning of this reading, Doctor? I agree with you wholeheartedly. The results could be worse. I've got the reading. What does it all mean? Have you figured it all out yet? That makes sense given the symptoms. I knew it! Which medication do you think is best in this case? Almost done. She seems to eat a normal amount, but the neighbors who brought her in said she'd vomited when they tried to feed her. Her stool is normal, but she drinks a lot of water and has been urinating more than other cats. Red appears to be the prodigal cat. She was maybe a little overweight when she ran away a while ago. Her owners moved away, but their former neighbors recognized her when she showed up in the neighborhood again, looking a lot thinner than she had.
Red was suffering from hyperthyroidism, a common disease of older cats. Overproduction of hormones in the thyroid gland cause weight loss, an irritable personality, kidney damage, high blood pressure, poor hair coat, increased heart rate, and heart murmurs. These problems can, in turn, cause blindness, strokes, and damage to the kidneys. Red could have died, but those oral medications will control the disease, so she won't continue to suffer. I can't fault your diagnosis. Good job! You asked all the right questions. Good job! Your treatment of this case was wonderful, and I'm sure your patient appreciates it.
He doesn't look too good. That's not a good sign. Oh no, this is really serious. That was a great move. Excellent. Do you hear that? I've got a pulse. So does this patient. This is really bad news. It never hurts to be thorough. You're better than I thought. Just kidding, you're doing great. What do you think it is, Doc? I'll be as good as you. Someday. Okay, I've got a bunch of medications to choose from. Which should I give? Now we don't have to worry about infection. Do you see that? It may not taste great, but it's just what you need. When he first came in, He was sleeping all the time. Not too surprising for a cat, but he wasn't interested in eating either. He sometimes breathes with his mouth open, like he's slowly panting. There are no other cats acting this way. Thank goodness.
Nitty experienced congestive heart failure, a condition very common in dogs, but less so in cats. Over time, the diseased heart changes shape to pump enough blood. Eventually, the heart can't keep up, and fluid builds up in the chest. This fluid prevents the lungs from giving enough oxygen to the blood. The medications you prescribed will help decrease the fluid in the lungs and help his heart beat more efficiently. Your diagnosis makes sense to me. I'm pleased. You knew to ask all the right questions. Your treatment of this case was perfect.
That's good news. I've never made a mistake with medications. Just tell me which ones to administer, and I'll do it. Now we have one less thing to worry about. No, she has been enjoying her food just fine. Yes, she is a lot friendlier and doesn't drink too much water anymore. No, I've noticed she stopped pacing in her cage and seems less anxious overall.
Now that Red's thyroid levels are back to normal, she won't be experiencing the symptoms of her hyperthyroidism. The oral medications will combat the disease, but unfortunately they won't cure it. While she continues to take these medications, Red should live a long and healthy life. You have chosen the correct diagnosis for this patient. I'm pleased. You knew to ask all the right questions. Your treatment of this case was perfect.
He's a playful one. Does this reading tell you anything? The lungs sound clear. We have to rule out all potential issues. Not since you treated him. It's still tender, but the ribs are healing. Yes, but he's a bit tentative because of his healing ribs.
Fortunately, Bruno's care after his accident was excellent. The nice man who delivered Bruno here knew he was in shock and wrapped him in a blanket to keep him warm. While Bruno did suffer from a buildup of air around the lungs, your decision to release the trapped air with a centesis needle allowed Bruno to breathe normally again. His broken ribs are healing, and as long as Bruno isn't involved in any high-impact activities, he should make a full recovery. Since his ribs aren't bothering him too much, he can now join the other dogs in the community housing center. Your diagnosis makes sense to me. You didn't ask one wrong question. I'm not surprised. Your treatment of this case was wonderful, and I'm sure your patient appreciates it.
animals love playing with you. The animals are really responding to your attention. You're doing a great job at socialization. The animals are really responding to your attention. Animals need playtime and so do we. That's one friendly pet. The animals are really responding to your attention. The animals are really responding to your attention. Did you know that playtime is essential to an animal's care? The animals are really responding to your attention. If you're both having fun, you're doing everything right. With you around, we'll have happy and friendly pets in no time. Training can be a lot of fun. That's a step in the right direction. You're really good at training. That shows progress. You're one great trainer. Wow, I can see the improvement. What a great move. You're one great trainer. You're doing a great job of training him. He's definitely improving. That shows progress. Getting wet is part of the job. Look how clean he looks. He is loving it. He looks amazing. I'm sure he appreciates your grooming time too. Nice and clean. You take such good care of the animals. Great grooming. That coat really shines. Don't they look great when they're properly groomed? Great grooming! That coat really shines! I love my job, even with the smell of wet fur. I can see the effort you put into your grooming. He looks great!
You're doing so well treating the animals that they're being adopted left and right. Now we can rescue more animals, thanks to you. With all your hard work, you deserve a promotion. I just need to ask you a few questions, but don't worry, I'm sure you'll do great. You've helped save the lives of an amazing number of animals and found them great homes. For all the animals who can't do it themselves, we'd like to thank you for all your hard work.
Just imagine how many animals you've helped.
I don't have to imagine. I saw how hard you worked on each dog, cat, iguana, macaw. Need I go on? I'm thrilled I got to work with you.
I'm even more thrilled to have played with you. You helped our animals, and I know you made some good friends. I hope I'm one of them.
Me too. You really cared for all the animals equally. Even the chinchillas spoke well of you. Well, they would have if they could speak.
So we'll do it for them. Wonderful job saving all those animals, and thanks for being such a great pet pal.